Globally, the prevalence of sickle cell disease is the highest in sub-Saharan Africa, as sickle cell trait condition has a protective effect against severe falciparum malaria. In Sierra Leone, the exact prevalence and incidence of sickle cell disease is unknown, but the frequency of the trait is estimated at 20 to 25%. People affected with STD may require recurrent hospitalizations for acute pain crisis, infections, cardiac problems, renal failure, and acute chest syndrome. I had the privilege to speak with Margaret Cassell, Alpha Jane, and Abdul Aziz Conte, who shared their personal journeys, offering a glimpse into their strength required to confront sickle cell disease.
It's been quite a journey, and now I have learned to manage the condition, because as you age older, you get to know your body better, you get to know your triggers and avoid your triggers as much as possible. But growing up, I had a healthy childhood, but in the university it was stressful. I was always missing exams, I was always rewriting exams, I was always in the hospital. So I faced a lot of challenges with my health in the university. Sometimes people give up on you, so you have to be strong for yourself.
We all have dreams as sickle cell carriers. We do also have dreams. And I feel like when people try to point fingers or trying to talk back at you, or when you're not doing something right, they don't actually know. I feel like if there's more sensitization on sickle cell disease, I mean, I've been having some problems with, like, sometimes you just wake up, you don't want to do anything, you just feel like you're tired or you're weak, you don't want to do something. These are all parts of being a warrior, but people do not understand this, and they tend to talk about stuff like that. And that sometimes people do actually say things, that actually change your mood and that will put you in some situation where you start asking yourself, or you start asking God, why?
To my companions that are out there being afraid of this disease, but this disease, if you take your medications and you do as the nurses say, it will not affect you like really hard that you will think of dying. And if you take your medication, like, you will live longer, and you will live longer and your life will be extended. Like me, I take my medication, and here I am, 15 years old, SS2 boy.
Healthcare disparities loom large in the lives of sickle cell patients. Many lack access to specialized care, affordable medications, and pain management options. Experts weigh in on the urgent need to address these disparities and improve the healthcare system.
There was a time when people used to say that if you're a sickler, you cannot live beyond 21 years. That's a myth. It's not correct. Once it is known that somebody is a sickler, there are certain measures that should be taken. There are certain preventive measures that should be taken to improve on the quality of life. So that's why, in fact, our emphasis now is to make the diagnosis at birth, right? So once you make the diagnosis, then you know that this person needs special care. People with sickle cell anemia, they are prone to having malaria, so that we usually advise them to get prophylaxis against malaria.
The battle against sickle cell disease isn't being fought in silence. Across the nation, there has been a growing movement to raise awareness. Advocacy groups, healthcare professionals, and those affected are joining forces to educate communities and push for improved conditions, increased research, and enhanced support network.
Again, in Sierra Leone, the cost of living is so high, and some of the families, most of them are coming from poor homes. Even to have money to pay to come for their services, it's a problem for them. So they have financial constraints, because this is a condition that is not something that you can have once in a while, let's say once in a year. Some of them every month, some of them every other month. You have to pay transport to come to the facility. Like with us as a Real Sickle Cell Society, everything is free as long as you can pay to come there. But then when they have a condition that they need to be hospitalized, and they need to have specialized drug, that is where the problem comes again. They cannot afford to buy the medicines. And sickle cell disease is not included in the free healthcare service.
Living with sickle cell disease is a daily struggle, but it's also a story of resilience, hope, and the power of community. More reason why the government and other well-meaning institutions that are aimed in providing better conditions for those facing this challenging condition should act now. Marina Terry, AYV News, Freetown.